G8 leaders arriving to Muskoka have a busy agenda tomorrow. One of the central issues they'll be discussing is maternal and child health. And ahead of the summit, Dr. Chamberlain Froese met with the Prime Minister just this week to discuss ways G8 leaders can bolster maternal health in developing countries. She is the founding director of Save the Mothers. This organization works to improve the lives of young mothers in developing countries. She's also the director of the International Women's Health Program at McMaster University. And she joins us from Hamilton today. Dr. Jean, thanks so much for taking the time to be with us. I understand you're dashing off from this interview to the G8 summit in Muskoka, so we'll let you get to it. But first, I wanted to ask you about numbers. In Canada, I understand by statistics, 10 to 15 young mothers will die every year because of maternal health issues. How does that compare to African countries?
Well, certainly in Uganda, where I live 8 months of the year, the statistics are astounding. 6,000 mothers die from pregnancy-related complications. And actually, they're not just young mothers, and very often they're older mothers as well, too. And those are the mothers that leave behind 6 or 7 orphans. So Canada and Uganda have the same population, 10 to 15 mothers in Canada and 6,000 in Uganda.
So why are they dying?
Well, they die from bleeding to death, another term, hemorrhage. They die from infection. They die from being in labor too long. And many do die as well from complications of abortion, whether induced or spontaneous losses.
Well, you met with the Prime Minister earlier this week. What was your discussion about?
Well, the discussion was really about what's the importance of this, and I think, you know, he's had a lot of challenges in bringing this position forward for saving mothers, and as a person on the ground seeing mothers dying, I'm kind of scratching my head saying, wow, why is that? We as Canadians should really get behind this tolerated tragedy of the 21st century where mothers, 500,000 mothers around the world and 4 million babies dying from complications related to pregnancy. So I think it was really a time just to focus on what are the key issues, what are the key interventions that we can do, and that it really is an important issue for our global community.
So what did you tell him then when he asked what can be done? What do you want to see come out of G8?
Well, certainly I think the provision of emergency obstetrical care, so in other words, helping mothers who are having complications. 15% of all mothers will have a life-threatening complication sometime during their pregnancy. So them being able to get the care that they need. Certainly there were others there at the meeting that were emphasizing the need for micronutrients. Micronutrients save many babies' lives and mothers as well, too. Particularly in my situation, I'm also emphasizing the need for leadership. You know, there's many social, cultural reasons why women don't get care. It's seen as being more of a mother if you deliver at home miles and miles from the hospital instead of getting the care that you need. And so women need to be valued. People need to think ahead and say, how do we save the lives of mothers in our community? But that takes leadership on the ground, and much as we develop leadership here in Canada, in fact, I'm speaking to the Youth Summit at the G8 today, those are young leaders, we also need to develop leadership in developing countries, politicians, journalists, social scientists, people of influence, religious leaders who can help people in those countries realize, you know what, mothers are worth saving. It's worth planning ahead to make sure that mother has a safe delivery.
Dr. Jean, just one question before we let you go. On your website, you listed a statistic that I found shocking, and I think for this issue, which is new to a lot of Canadians, they might find this interesting as well. You said that when you combine tuberculosis, accidents, suicide, and AIDS, HIV combined, they still don't add up to the number of mothers who die from maternal health issues.
That's correct. For the 20th century, if you added up over the 20th century how many mothers died, that would be correct. Now, it's changing now in terms of some of those statistics, but if you look at maternal deaths and neonatal deaths and stillborns over 1 year, it's about 4.5 million individuals versus HIV/AIDS claimed about 2.3 million last year. So the difference is that nobody counts those neonates, nobody counts those newborn babies that die, or it's very difficult for them to be counted, versus HIV deaths are very much more counted. So really, we're talking about people who are voiceless. We're talking about mothers who bleed to death out in their village and young babies that either are born dead or die within the first week of life. And that's why there really hasn't been a global emphasis on this issue to date, because nobody knows about them. And so I really applaud the government's emphasis on this important issue in our global village.
All right, Dr. Chamberlain Froese joins us from Hamilton, Ontario. She advised the Prime Minister on his maternal health proposal for the G8 summit, and will allow you to head up to Muskoka now. Dr. Jean, thanks for your time today.
Thanks very much.